Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about.
Then we have Van Nuys Prognostic Index. According to the Van Nuys Prognostic Index, it is used to classify the it is used mainly to classify the ductal carcinoma in situ. Okay. So according to Van Nuys criteria, actually, this one use criteria is based on the following: based on the patient's age, ductal carcinoma in situ, nuclear grade, and also presence of microcalcification, size of the lesion, and width of the surgical margin. So, all these are important for Von News Prognostic Index. Then, then we have staging of breast carcinoma. In the staging of breast carcinoma, we have T. T means primary tumor. Okay. In the primary tumor, first we have T1. T1 is tumor is less than or equal to 2 centimeters. In T2, the tumor is almost equal to 2 to 5 centimeters. In T3, the tumor is more than 5 centimeters. In T4A, there is extension to the chest wall is seen, not and this extension to the chest wall is seen not including the pectoralis muscle. Then we have T4B. In T4B, you will see that there is edema is seen, and this edema mainly includes the including body orange appearance is seen in the patient. Body orange appearance is seen in the patient, or there can be ulceration of the skin can be seen, or there can be satellite nodules are seen which are actually confined to the breast, same breast. Then we have T4C. T4C is if there is T4A plus T T4A plus T4B is T4C. Then we have T4D, which is inflammatory edema, is called as T4D. Then we have N. N is for regional lymph nodes. In the N we have N1. N1 shows metastasis to movable ipsilateral axillary lymph nodes. Then we have N2A. In N2A, there is metastasis is seen to immobile, or the ipsilateral axillary lymph nodes are involved, and this ipsilateral axillary lymph nodes are either fixed or matted. Then we have N2B. In the N2B, there is metastasis is seen to clinically apparent ipsilateral internal mammary nodes. Then we have N3A. In N3A, metastasis is seen to infraclavicular lymph nodes, whereas N3B. In N3B, there is metastasis to both ipsilateral axillary lymph nodes plus ipsilateral internal mammary lymph nodes. Then we have N3C. In N3C, there is involvement to or metastasis to supraclavicular lymph nodes. So these are about regional lymph node metastasis. Then we have M. In M, we have distant metastasis is also seen in M.
Thank you and thank you for watching.